For our presentation, we will be discussing inflammation and autoimmunity. Our topics include what is an immune system, autoimmune diseases, and what causes autoimmune diseases to occur, inflammation, autoinflammatory diseases, connections between inflammation and autoimmunity, and finally, treatment for autoimmune diseases. What is the immune system? Before we begin, we first want to discuss how the immune system works. An immune system protects your body from foreign species such as bacteria, virus, fungi, and toxins. There are two different parts to the immune system, including the innate and adaptive immune system. The innate immune system is something that you're born with and acts as our first line of defense against pathogens. For example, when first exposed to a virus, our bodies will naturally create mucus, a sticky material that coats our lungs, throats, mouth, and nose in order to trap the virus. Another natural reflex that is a part of the innate immune system is coughing. What differentiates the innate immune system from the adaptive immune system is that it is not developed around a specific pathogen in order to be activated. Instead, it depends on a group of proteins and phagocytic cells that have the ability to recognize the features of pathogens and activate to destroy the foreign species. The adaptive immune system is something that's developed slowly over time as your body becomes exposed to different pathogens. In comparison to the innate immune system, the adaptive immune system takes a longer process during the initial exposure due to the activation and expansion of B and T cells. Together, these two parts work in harmony to make up your immune system. One essential aspect of the immune system is its ability to recognize the difference between our own healthy tissues and organs and potentially harmful pathogens. Autoimmune diseases. Autoimmune diseases occur when your immune system no longer has the ability to distinguish between your own cells and pathogens and will therefore attack your own healthy organs and tissues. One important classification of autoimmune diseases is the regulation or death of T and B cells, as well as the response of these cells and antigens. According to studies, there are over 80 different types of autoimmune diseases that can affect various parts of your body. Some autoimmune diseases can either be systematic, meaning it can affect multiple organs, or organ-specific, where it targets and affects a particular part of the body. Both types have the ability to coexist in the same patient, either at the same time or concurrently. Some commonly known autoimmune diseases include alopecia, which is a disease of the skin which causes hair loss, type 1 diabetes, in which the immune system attacks the pancreas, as well as rheumatoid arthritis, where the immune system can attack different parts of the body, including the joints, lungs, and eyes. Self-tolerance and autoimmunity. According to the article titled Path to Understanding the Genetic Basis of Autoimmune Diseases, researchers utilized the concept of self-tolerance to describe the body's ability to distinguish healthy versus unhealthy organs/tissues. The mechanism of self-tolerance has been studied by analyzing CD4+ T cells in animal models. Self-tolerance can be divided into two parts, including central and peripheral tolerance. Central tolerance describes the death of immature lymphocytes with receptors that are able to recognize self-antigens. These lymphocytes are produced in the generative lymphoid organs such as bone marrow for B cells and the thymus for T cells. When these lymphocytes receive the correct antigen signals, they will leave the thymus and circulate in the periphery. Lymphocytes that do not receive the signals will undergo apoptosis. In other words, these self-reactive B and T cells are removed from the system at an early stage. In comparison to this, peripheral tolerance is when mature lymphocytes in the peripheral tissues are either killed or shut off. However, when these self-reactive lymphocytes escape from tolerance or apoptosis, this can lead to the development of autoimmune diseases. What causes autoimmune diseases to occur? While there is no direct causation for the development of autoimmune diseases, they can often result from a combination of genetic inheritance, mutations, as well as acquired environmental triggers such as weight, smoking, and certain medications. Genetic inheritance. Part of the path to understanding the genetic influence of autoimmunity was to analyze genetic inheritance. In the past, epidemiologists have studied monozygotic twins, in which results showed that when one twin develops an autoimmune disease, such as multiple sclerosis, the other twin has a 30% chance of acquiring it as well. Furthermore, other studies have shown that if one person has developed an autoimmune disease, there's an increased risk for members of the same family for developing as well. Based upon these results, it is clear that there is a correlation between genetic inheritance and autoimmune diseases. However, the overall impact on the population is very small. In other words, genetic inheritance is not the primary inducer of autoimmune diseases for the overall population. This is primarily due to the fact that genetic inheritance of autoimmune diseases does not follow the Mendelian theory, making it difficult for epidemiologists to map. Genetic mutations. Over the years, researchers have discovered one mutated gene named AIR, which plays a central role in the development of autoimmune polyendocrine syndrome type 1. Autoimmune polyendocrine syndrome is an organ-specific autoimmune disorder that causes the autoimmune to attack against the skin and other tissues. When developed, AIR shapes the body's immunological tolerance by decreasing the negative selection of T cells in the thymus. By escaping negative selection, the T cells do not die and now have the opportunity to attack the body's own tissues and organs. Another example is the autoimmune lymphoproliferative syndrome, which is an autoimmune disease due to a mutation in the FAST protein or its receptor. The FAST pathway is important because it mediates apoptosis, which regulates the immune responses. This mutation often results in an inability to trigger apoptosis of the activated immune cells after coming into contact with an antigen or a foreign substance. Environmental triggers. Obesity increases a person's risk for developing rheumatoid arthritis or psoriatic arthritis. Researchers hypothesize that this could be because increased weight puts greater stress on the joints or because it encourages inflammation. Smoking. Studies have shown that there's a correlation between smoking and the development of various autoimmune diseases, including lupus, rheumatoid arthritis, hyperthyroidism, and multiple sclerosis. One reason why smoking is linked to autoimmune diseases is because studies have shown that it can trigger oxidative stress and may contribute to dysregulating DNA methylation and upregulating immune genes, which can therefore lead to autoreactivity. Medications. Finally, certain blood pressure medications or antibiotics can trigger drug-induced lupus. In addition to this, certain medications used to lower cholesterol can trigger myopathy, which is a rare autoimmune disease that can cause muscle weakness. Treatments. There are no cures for autoimmune diseases, but symptoms can be managed. Here are some examples of medications used to treat autoimmune diseases, including painkillers, anti-inflammatories, insulin injections, sleeping medications, plasma exchange, corticosteroids, established immune globulin, and drugs that suppress or subdue your immune system.
So now we'll move on to the topic of inflammation. First, we have to discuss what inflammation is. Most people know inflammation as any kind of red, hot swelling that occurs on the body, as shown on the left ankle in the picture provided. And this redness, swelling, and heat are essentially a physical visual of the body's process to repair any damaged tissue in the body. And the goal of inflammation is to either control or eradicate whatever is damaging the tissue in the body, so the tissue can be repaired and healthy again. So there are two types of inflammation, acute and chronic. Acute inflammation is a short-term inflammation. Since inflammation falls primarily under innate immunity, acute inflammation is one of the first lines of defense against injuries and infections. Acute inflammation typically lasts anywhere from minutes to days, but this depends on the pathogen or the injury. The major steps of acute inflammation are to locate the pathogen and degrade or kill it, which will rid the body of the infection. Macrophages will engulf the pathogens present and will release inflammatory mediators and cytokines. The cytokines will induce the expression of selectins that will bind to the leukocytes to slow them down. And the leukocytes, assisted by adhesion molecules, cytokines, and chemokines, will go to the site of infection and phagocytose those pathogens. And the damaged tissue will then be repaired, and the leukocytes that cleared out that infection will be destroyed by the lymphatic system. So chronic inflammation is a long-term inflammation, and most of the time, chronic inflammation results from unsuccessful acute inflammation or uncontrolled tissue damage, which is why it's a delayed response. As the visual shows, chronic inflammation starts the same as acute inflammation, where a pathogen harms the body, but instead of the pathogen getting taken down by those acute inflammation cells, it continues to cause damage. And chronic inflammation can last anywhere from days to months or even longer, depending on the illness. Usually, autoinflammatory diseases are known to have chronic inflammation as a key symptom. Most of the cells that are present for chronic inflammation are cells that last longer, such as macrophages, because since they last longer, they can really fight off the chronic inflammation. So the purpose of inflammation is to remove any kind of pathogen from the body. This is through getting phago- phagocytic cells like macrophages and leukocytes like neutrophils to the site of damage and infection so they can fight off and kill the invasive pathogens. If the inflammation as a whole is ineffective, the next step that the body will do is try to contain the pathogen via a granuloma. So there are many causes of inflammation, but the most common are pathogens or infections. So this includes like fungi, viruses, and bacteria. Any kind of traumas like external injuries, punctures, abrasions, and lacerations. Environmental factors like chemicals and UV light exposure or radiation, emotional and physical stress, poor diet choices, and poor sleeping habits. So the symptoms of inflammation can be summarized in the acronym HERPA. The H stands for heat, which is due to so many things that are happening at once in the body. The E stands for edema, which is the capillaries leaking fluid, and this is due to the endothelial junction loosening to let the leukocytes out so they can go to the site of infection. Bradykinin, histamine, and cytokines aid in the loosening of that junction. R stands for redness, which is caused by damage done to the tissues. P stands for pain, and the pain comes from different aspects of inflammation, such as the prostaglandins that are being released from the junction loosening, as well as the histamines that loosen that junction. And A stands for altered function. Since that specific part of the body is injured, it obviously can't function as it normally does. So now we'll move on to talking about autoinflammatory diseases. So, an autoinflammatory disease, like an autoimmune disease, is caused by innate immune system dysfunction. The body is attacking the healthy cells the same way that it attacks sick cells. And this attack causes damages to healthy cells and causes chronic inflammation. Many autoinflammatory diseases are not fatal, but there are a rare few that are. So, the causes of autoinflammatory diseases are usually genetic mutations, specifically genetic mutations in the genes that regulate the innate immune system. So, for example, the mutations in the NLRP3 gene causes a gain of function that activates inflammasomes, and mutations in the genes that actually encode inflammasomes also causes inflammation. And the symptoms are pretty similar to the symptoms we were talking about before for inflammation. um, you get fever, chills, gastrointestinal symptoms, muscle and joint inflammation, inflammation of your internal organs, and a lot of them also have skin rashes that you can see. So, one example of an autoinflammatory disease is familial Mediterranean fever, or FMF. Familial Mediterranean fever is caused by a mutation in the MEFV gene that codes for the production of pyrin, and pyrin is thought to assist with the regulation of inflammation. And the symptoms present are inflammation, abdominal pain, arthritis, and chest pain, and this can be impaired in children and adults. Another example of an autoinflammatory disease is neonatal onset multisystem inflammatory disease, or NOMID. NOMID is apparent in newborns and children and is characterized by recurring inflammation that causes tissue damage in various systems throughout the body. Rash, fever, and joint damage are usually the symptoms that you see. And NOMID is caused by a mutation in the NLRP3 gene, which we were talking about before, which creates that cryopyrin, which is thought to be associated with inflammation. So the treatment of autoinflammatory diseases involves NSAIDs, and NSAIDs are non-steroidal anti-inflammatory drugs that hinder the production of the chemicals that cause inflammation. So, for example, an injection of Ilaris, which is a drug that is used to treat FMF, acts as an immunosuppressant that stops inflammation from diseases like FMF. So the connections between inflammation and autoimmunity are that both work to attack the healthy body instead of doing their normal function and getting rid of things that are not healthy in the body, such as like those pathogens or injuries and things like that. So, a review done by L. Shibani and others suggests that autoinflammatory diseases should actually be categorized under autoimmune diseases, since autoinflammation is generally an autoimmune disease. Both are attacking the healthy cells instead of doing their normal function and attacking the unhealthy cells. And that is it for our presentation. So these are our two quiz questions. The first one is, which one of these causes autoimmune diseases? Which one is false? And the second one is, which of the following is not a symptom of inflammation?